We are going to talk to Professor Neil McKaganey, who is Professor of Drug Misuse Research at the Centre for Drug Misuse Research at the University of Glasgow, which he set up in 1994. We have spoken to Professor McKaganey before, last year, but we are going to do another interview because Professor McKaganey has just published a book entitled Controversies in Drugs, Policy and Practice. We're going to talk about the book later, but first of all, welcome to WFAD broadcast, Professor McKaganey.
Morning, Tony.
I would like to ask you, first of all, what would you regard as the most pressing issues when it comes to drug policy in your country today?
Well, I would say two related things, really. One is the sheer scale of our drug problem in Scotland. We have a drug problem the size of which is virtually unrivaled anywhere in Europe. And Scotland is a small country, though we have an estimated 55,000 heroin addicts. That's approaching 2% of our adult population. So you can see that the problem in scale is very substantial, and it's actually of relatively recent origin. Our drug problem, to speak of, began really in the late 1980s. So in historical terms, in a relatively short period of time, Scotland has gone from barely having a drug problem worthy of the name to having a drug problem which is virtually unrivaled anywhere in Europe. And the second thing really related to that, I think, is really the level of our drug-related deaths. We are seeing, and have seen over the recent years, a steady increase in the numbers of addicts dying. And we seem really unable to bring that total down with the range of harm reduction measures that we've been vigorously pursuing over a number of years.
Now, if we look at the first problem you mentioned, that you have had more or less an explosion of use of drugs and consequently drug addicts, what would be the explanation for this, do you think? How come that you have such an enormous amount of drug addicts in your country?
Yes, I mean, Scotland is a society that's very divided. It has major areas of poverty and what we call social exclusion. These are areas where people have very little investment in society. They have little expectation of attaining any sort of affluence or social status. And in that context, it's easy to see that drug use has proliferated remarkably. But I think that's only part of the explanation. Allied to that is that we haven't really ever adopted a clear view as to the benefits and the necessity of drug prevention in Scotland. Our policies for certainly the last 15, probably nearly 20 years have been very much framed in terms of trying to reduce the harms associated with our drug problem, rather than determinedly reducing the scale of the drug problem itself. And I think it's perhaps no great surprise then, given the kind of official agnosticism around drug prevention, that our problem has proliferated to the degree that it has.
So what do the politicians responsible for the drug-related issues propose? What do they propose for handling the problem?
Our principal response to our drug problem is really a medical response, is to prescribe methadone, which is now prescribed to almost half of our entire addict population. To prescribe methadone on really a maintenance that is an unending basis. The idea being that if you can prescribe methadone to heroin addicts, that you at least reduce their need to resort to criminality to fund their drug habit, and thereby hopefully reduce one of the major adverse impacts of drug abuse on society. But it is spectacularly ineffective in terms of actually reducing numbers of addicts. I mean, we see here, and as has been shown in research in Edinburgh, for example, that once you start prescribing methadone, you really can lengthen the period over which addicts remain dependent for very many years, certainly in excess of 10, 15, 20 years they may remain dependent. So that's been our predominant government approach. But I also think that successive governments have been rather overwhelmed by the scale of our drug problem. And they're almost too frightened, I think, really, to approach it with renewed determination and renewed focus on prevention. There is a kind of, I think, an anxiety that the best that we can do is to try to reduce some of the levels of criminality and some of the harms associated, and that so many politicians here have effectively given up on the idea of Scotland actually overcoming its drug problem.
So it's more a question of containing the problem than solving it.
Yes, I think containment is the predominant notion underpinning our drug policy, and that has been the case over many years.
Now you have.
I was just going to say, Tony, that I think that in itself is surprising, given the relative recency of our drug problem. And one is not talking about a problem that's been a characteristic for the last 50 years. In historical terms, as I say, it's relatively recent. So I think there is no grounds for that level of pessimism at all.
But do you think you can change that pessimism into optimism?
Well, it is. It's hard to be. It's hard to expect great success, because I think there are so many people advising government and so many ministers when they attain government positions, so many politicians when they assume government responsibilities, that seem somehow or other to be surrounded by this sort of pessimism. Interestingly enough, often in opposition, they're very much more vigorous and enthused with the possibility of turning around our drug problem. But unfortunately, once they assume ministerial responsibilities, there descends a certain pessimism, the idea that actually the best that they can do is indeed now containment.
So what will happen then in the future if this goes on and nothing sort of is done to counteract it? What will be the end of all this?
Yes, personally, I think it's very alarming, because I see no grounds for supposing that our prevalence rate of nearly 2% is the ceiling, that we've reached the upper point of our serious drug problem in Scotland. I mean, those who are vigorously promoting drug abuse for financial gain, they certainly are not satisfied at the level of our current drug problem, so they are doing all they can to promote it more widely in our rural areas, well beyond our urban areas. So it does seem to me entirely possible that our drug problem, shockingly high as it is, will continue to increase. We will see children of a earlier and earlier age demonstrating the signs of serious drug abuse. We've estimated in Glasgow, for example, that there are some 50 children in their pre-teens, that's under 13, who have started to use heroin already, and I think that is what we will see. Children of an age that many of us would be absolutely horrified at the prospect that they've even ever come across heroin. Children of such ages actually starting to use the drug and demonstrating very rapidly, given their young age, the serious adverse effects of it.
Now, heroin is the drug that is mostly used, is that it?
Yes, that's our most prevalent illegal drug, aside from cannabis, of course, the most problematic use. Although in recent years we've seen a marked increase in cocaine as well.
Now, you have written a book that was published recently, and the title is Controversies in Drugs, Policy and Practice. Well, first of all, why did you write this book?
Well, it seemed to me that I'd been carrying out research on the drugs problem within the UK and elsewhere for nigh on 20 years. And in that time, I thought about and engaged in argument over a number of key issues. And I wanted in one place, really, to address what seems to me the fundamental areas of controversy which bedevil our attempts to tackle our drug problem, not just within the UK, but on an international stage as well. And I wanted to ask some pretty fundamental questions, one of which, for example, is, have we been well served by the harm reduction approach that's been vigorously pursued in many countries over the last 20 years? Has that actually delivered the sorts of benefits that many of its most ardent proponents said that it would deliver? So I wanted to ask some pretty basic questions. That was one: has it been effective in reducing harm, or have many of the harms associated with drug use continue to expand even in the face of harm reduction? I wanted to look at the issue of liberalising our drug laws, because within the UK, I think as part of that pessimism, which seems to descend around the whole topic of illegal drugs, I wanted to address the question about should we be considering liberalising our drug laws. And I wanted to ask the question in a way that where is the moral dimension of our drug laws? Because it seems to me that we've rather moved away from any notion that there are a series of moral questions around illegal drug use, treating it really as a matter of individual choice. And I think that in itself has been a rather dangerous direction to go.
Now, the second chapter in your book is called "What's Wrong with Harm Reduction?"
Yeah.
What is your conclusion there?
Well, in a nutshell, I think it doesn't work. It's captured, I think, the most successful marketing of an idea in the drugs field over the last 50-odd years, because I think there is nothing wrong with the idea of reducing drug-related harm. It's an idea which immediately draws support from all manner of quarters, and yet the reality, it seems to me, when you look at those countries that have invested heavily in harm reduction, what you see are countries whose drug problems are not characterised by low levels of harm. Their drug problems very often characterised by very high levels of drug harm, continuing high levels. And the UK is a classic example of that. I mean, aside from HIV, which is often trumpeted as the main success of harm reduction measures, although we're seeing HIV levels increase in the UK, in almost every other single respect, our drug problems characterised by massive and continuing and increasing harm. So despite all our efforts to reduce harm, I think the sobering conclusion that we must come to is that it actually is only by reducing the overall level of drug abuse in society that one can have a significant impact on reducing the level of drug harm. If you don't succeed in reducing the level of drug usage, you are almost certainly not going to succeed in reducing the levels of drug harm. Now, that may seem a rather simple understanding, although it's one that has eluded us in policy terms for many years, and to a degree continues to elude us as we continue to invest heavily, much heavier in harm reduction than drug prevention.
The final chapter in your book, chapter 9, conclusion, you put the question, so what's morality got to do with it? Could you elaborate a bit on that, please?
Yes, because I'm surprised in many ways our discussion around the moral dimension of the drugs issue is so muted. But it seems to me that if you take the goals of drug prevention seriously and take them to heart, that for the most part the tools within one's armoury are pretty modest. So, for example, some of the health harms associated with drug abuse, if you compare the level of use, for example, of cannabis, the level of smoking of cannabis relative to the numbers of people who experience mental health harms, it's a tiny fraction. If you're trying to discourage cannabis use by saying you may become unwell and experience psychiatric problems, that's not likely to persuade very many people, because we know that the numbers of people who will experience those problems is quite small. Similarly, if you say you may be arrested and acquire a criminal record, again, we know that it's only a tiny fraction of people who are arrested of those who are smoking cannabis. And yet somehow I think that what we really ought to be putting to young people and engaging young people in a discussion of is, well, what is the moral place of drug abuse within society? Do we, you, they want a society where drug abuse is a socially acceptable area, pattern of behaviour? Does it enhance the value of society, or does it damage the value and values in society? And I think those are moral questions, and in a way, I think they offer a much more powerful way of reducing the levels of drug abuse, in which the question you ask, is it right for the individual to pursue his or her own immediate interests and needs against the social harms that flow from those individual needs? And I think that we really ought to encourage a moral debate around the issue of illegal drug use, much in the way that we have around alcohol. I mean, we've accepted a moral argument around alcohol, that it's morally wrong, for example, to drink and drive, that anyone who does that is seen as immoral, and there's a powerful social sanction against that. And I do believe that we have to really invoke the same sorts of ideas around drug abuse.
Well, thank you for talking to us, Professor McKaganey. You will be able, you are listening, those who are listening to this broadcast will be able to read more about the book. We'll publish information about that on the WFAD website. So thank you very much for talking to us.